This video will be about 4D ultrasound, presented by Nicole, Olivia, and Cathy. We will explain what ultrasound is, what it can do, and then the following issues associated with 4D ultrasound. The leading cause of death among newborn babies to infants are usually heart diseases. Imagine giving birth to your little one and finding out they won't live any longer than 6 months because of a heart problem. Devastating, right? So, any method of detecting heart diseases early on in childhood has become highly valuable to doctors. Later on in Australia, not long after being able to see your baby in 3D ultrasound, in the early 2000s, GE Healthcare announced the first 4D ultrasound technology.
According to recent statistics, pregnant women in Australia have been taking 4 to 5 ultrasounds per pregnancy, a significant increase.
What makes it so different to 2D ultrasound and 3D ultrasound? Now, 2D ultrasound creates a flat old school black and white image of your baby, usually the traditional method that's been used for years. 3D ultrasound, a more advanced technology, takes a 3D image of your baby, allowing you to see very defined features and formation. Now, 4D ultrasound can do something all the others cannot. View the baby in real time, either sucking their thumb, turning around, and yawning.
How does it actually work? A device known as a transducer is moved along the womb and abdomen with a gel placed onto the area. This device sends pulses of sound waves through the uterus, which bounces back to the transducer. The amount bounced back depends on the density between adjacent tissues. The transducer will then pick up the reflected sound waves and translate them onto a screen. This will be helpful in the detection of a heart disease.
What can 4D ultrasound help with? As mentioned before, 4D ultrasound can be a useful tool for the detection of heart diseases in babies prior to birth. The 4D ultrasound machine is able to view subjects in a higher resolution. By having an XYZ plane, the machine can create a period of images of the cardiac system that can be stored as individual frames. This is known as a sine loop. These series of individual frames are then correlated with the correct volume. Examiners can then analyze the volume dataset and determine the healthiness of the fetal heart.
We'll give you this.
Advantages for 4D ultrasound. Although there are many negative issues arising in the world about using 4D ultrasound machines, they also have been very useful in checking the overall condition of the expectant mother and her unborn child. Development, age, growth, and any signs of problems the baby can have are all variables that can be checked in a typical 4D ultrasound session. This fast examination procedure can provide the doctor with not only qualitative data but also quantitative data to diagnose and accurately identify the gender and any abnormalities of the baby. This machine is also very important for the expectant mother, as a number of conditions could arise due to pregnancy, such as infertility, measurement of tumors and cysts. So the data extracted from an ultrasound machine can positively impact physicians as it provides them with detailed information to diagnose and treat the patient correctly. So, why are there so many problems arising? Ever since parents have been rushing to pay good bucks to take a good look at their unborn baby and even take pictures. To the parents, magical. To the doctors, unacceptable. Due to ultrasound advancements, the 4D ultrasound machine has further increased the community's access to these technologies, which also increases the safety risks for both mother and their unborn child. In today's society, media has played a crucial role in technological advancements, and through this one of the most current trend that has been widely displayed through print, digital, and social media is to have ultrasound parties.
So what are ultrasound parties? This so-called party is when a technologist performs an ultrasound in the comfort of the expectant parent's home. 4D images are produced at a fast rate and shared immediately to their family and friends. However, medical experts are highly against using ultrasound procedure for their entertainment. A person who is not properly and highly trained in this field while performing this practice is putting greater risk on the fetus. But laying the transducer over the mother for hours and hours would have a detrimental effect on both subjects. So some say that the energy from these machines are too strong, that they can create gassy bubbles and heat up the tissue. This is because in 2D ultrasound, there is a very low heating of the tissues which has no effects so far, whereas 4D ultrasounds require higher amounts of mechanical energy and sound energy to create a quality image, meaning more heating. Even though there has been no evidence of any problems, doctors still highly recommend using 4D ultrasound machines only on expectant mothers after a whole diagnostic study has been performed.
The principle known as Ayala has also been stressed, especially with 3D and 4D ultrasound, to keep examinations within a safety limit.
This also leads onto the issue of untrained professionals, as 4D ultrasound machines are a powerful tool in society which could only be practiced by professionals who are medically trained in this field. However, many incompetent individuals who work for these services can give false indications to many parents about the health of their baby, which is a big no-no. As these individuals are unskilled and inexperienced, false positives can become a greater issue in society. For example, an unqualified medical technician can detect a harmless fetal cyst through a 4D ultrasound, which may lead to more tests that can negatively contribute to the overall well-being of the mother and her unborn child. There has also been cases where artifacts may appear on the screen, which could put the expectant mother under stress and anxiety. If the unprofessional technician tells her it is an abnormality.
Due to the production of moving images of the fetus, some mothers may automatically decide that having a 4D ultrasound session is a cheaper alternative to continuing their prenatal care program, as a 4D ultrasound can confirm any abnormalities of the baby. Due to a quicker overall medical study of the baby, some parents will disregard the prenatal care as this technological device has already provided them with the overall physical condition of their unborn child. If the images showed them that everything was okay and the baby was healthy, they would replace all other prenatal care programs because of how expensive and time consuming it is. However, medical specialists are highly disapproving of this option, as no one should never completely disregard other healthcare options, and anything can happen to both the baby and the mother at any time. Even though there are many advantages and disadvantages to using 4D ultrasound machines, 4D ultrasound machines can be safe used in the hands of a trained professional. This will limit the risks and allow them to see problems prior to birth, such as heart diseases, which can save many lives of unborn babies. So ask yourself, is it really worth it?